All right, this is the dynamic cardiology station. In this station, you'll be tested on your ability to electrically intervene with the monitor, either cardioversion, defib, or pacing, whatever might be required for the patient. You verbalize all of the treatments, intubations, IVs, and medication interventions, and we'll push time along. Whenever you're finished with your interventions, I will tell you when 2 minutes is up and we'll move to the next phase of your management. So are you ready?
Yes.
Okay. You have a 50-year-old male patient that was found down on the sidewalk. A bystander said that he grabbed his chest, complained of chest pain, and he's now lying on the ground unresponsive.
Okay. BSI and safe?
It is safe.
Sir, are you okay?
No response.
No response. I'm going to open his airway with the head tilt chin lift. Is he breathing?
No breathing.
No breathing. I'm going to have my partner drop an OPA and start bagging him with the BVM. Does he have a pulse?
No pulse.
No pulse. I'm going to have my other partners begin chest compressions. I'm going to hook him up to the monitor.
Okay.
With my fast patches. Okay. And I'm going to get all my stuff ready out for IO access and intubation in this 2 minutes.
All right. All right, it's been 2 minutes.
Okay. I'm going to do a pulse check. Do you have a pulse with this?
No pulse.
No pulse, it's PEA. So can continue compressions, continue ventilations. I'm going to get IO access at this time.
Okay.
And I'm going to intubate also. And also push 1 milligram of 1 to 10,000 of epi.
Okay, that's in. And it's been 2 minutes.
2 minutes? Okay. So I'm going to do a pulse check. Do I have a pulse with this?
No pulse.
No pulse? All right. So continue CPR, continue ventilations for another 2 minutes.
All right. It's been 2 minutes.
2 minutes. Okay. Okay, I see VTAC on the monitor. Do I have a pulse with this?
You do.
I have a pulse with this. All right, I'm going to synchronize cardiovert, and since I haven't shocked yet, I'm going to start at a 100.
Okay.
Okay, so it's synced. I'm going to charge it up while they're still doing ventilations. All right, we're going to shock on 3. Ready? Clear the patient. Ready? 1, 2, and 3. Shock delivered. All right. So I still see VTAC. Do I have a pulse with this?
Yes.
Okay. So I'm going to go ahead and shock again at 200. Still giving ventilations as I charge it up. Also syncing as I'm doing this. And we're going to charge on 3, or shock on 3. Ready? 1, 2, and 3. Okay. So I'm still seeing VTAC. Do I have a pulse with this?
You do.
Okay, I'm going to give 150 milligrams of amiodarone.
Okay. That's going in.
Okay, and then I'm going to charge it up to 300. And I'm also going to sync this. And it's still giving ventilations as I charge it up. Okay, we're ready for a shock, off ventilation, so I'm going to watch my patient, make sure no one's touching it. I'm going to shock on 3, ready, 1, 2, and 3. Shock delivered. And do I still have a pulse with this?
Yes.
Okay, it's VTAC. So continue ventilations, I'm going to charge it up to 360. Synchronize it, and still giving ventilations as I charge it up. Okay, off ventilations, I'm going to watch my patient, make sure no one's touching it. And we're going to shock on 3. Ready? 1, 2, and 3. Shock delivered. And, okay, I see VFib on the monitor, assuming no pulse. Get back on compressions and ventilations. Since it was witnessed, I'm going to shock at 360 again. So I'm going to charge monitor. Okay, off compressions, off ventilations, and we're going to shock on 3. Ready? 1, 2, and 3. Shock delivered. Okay, back on compressions, VFib, back on ventilations. We're going to push another 300 amiodarone and epi, 1 milligram of 1 to 10,000.
All right. It's been 2 minutes.
2 minutes. Okay, we're going to do a pulse check. Do you have a pulse with this?
No pulse.
No pulse. I'm going to charge it up to 360 again. off compressions, off ventilations. I'm going to shock on 3. Ready, 1, 2, and 3. Okay. So back on compressions, back on ventilations. And since I pushed my drugs the last 2 minutes, we're going to wait for our second 2 minutes.
All right. And it's been 2 minutes.
Okay, 2 minutes, we're going to do a pulse check. I see defib on the monitor.
Okay.
Assuming no pulse.
No pulse.
Okay, so we're going to charge up to 360 once again. As we're still doing ventilations and compressions. Okay, off compressions, off ventilations. We're going to shock on 3. Ready, 1, 2, and 3. Shock's delivered. And do I have a pulse with this?
You do.
Okay, can I get a blood pressure real quick?
Blood pressure is 60/30.
Okay. I see a 3rd-degree heart block.
Okay.
So I'm going to pace him. I'm going to hook him up to the monitor. And we're going to put him back into lead 2. Okay, we're going to hit the pacer, 70 beats per minute. And we're going to crank it up until we get capture. And I got capture right there, so we're going to set it right there. And I'm going to ask for, once I have electrical capture, I'm going to check for femoral and get a mechanical capture.
Okay.
Do I have that?
You have femoral pulse.
Okay. So I'm going to reassess my vitals and get my, as he's ventilating, I'm going to get my another blood pressure.
110/70.
Okay. If his blood pressure does tend to fall back down into the critical level, I could consider dopamine or epi drips.
Okay. All right. That's it. Thank you.